Hi everyone, I hope you're well. In this video, we are going to discuss about canine guidance and is it really necessary? Let's look at the reasons people who advocate canine guidance, why they think that canine guidance is important. So one of the reasons we use canine as a guidance is because it has got favorable root and crown ratio. So it's got really nice and long crown, which you can use for guidance. It also remains the longest in patient's mouth. So if you provide the guidance for that patient, you can be assured that it will be there in their lifetime the longest. Because it has long root, it has more PDL ligaments, and because of that, much more proprioception. Palatal surface of the canine guidance is very conducive to providing that guidance where patient has a concave convex surface, and you can get nice guidance when patient's moving on the sideways. So it's very easy to build guidance into canine. And it's in the mechanically favorable position, which is away from the TMJ. We know that the further back we go, the muscles are much more forceful and you can apply much more force. And we're using canine guidance mainly for lateral excursion. We know that the posterior teeth are not very good at taking lateral load. They're very good at taking vertical load, but we don't want to apply lateral load. And because of that, we want to stay away as forward as possible from our TMJ. And canine allows us to do that. What are the indication of groove function in that case? Groove function means that we are using more than one tooth for guidance. So it could be canine and a premolar, or canine and two premolars, or canine, two premolars and mesiobuccal cusp of first molar. We tend not to go further back than that. And even mesiobuccal cusp of first molar is very rare in situation where we are stuck. So we consider groove function where more than one teeth or tooth is involved is when your patient has a class 1 occlusion with extreme overjet, where patient's canine is not in contact. You have class 3 occlusion where again patient's canine is not in contact. Or you have some end-to-end occlusion where canine are in contact but only by 2-3 millimeter, and that's not enough to provide steeper, nicer guidance. So either you increase the height of the canine or you involve premolars into providing guidance. You have anterior open bite, as we discussed, when canine is weak. So if you have heavily restored canine or you're restoring canine with implant, I wouldn't want that to take the guidance. And this is the time when I'm using premolars, sometimes molars, to spread my guidance and reduce the load on canine. So in short, canine guidance and groove function are both useful in different clinical scenarios. So what are the tips for this video? Try and make your life as easy as possible. So if canine is healthy and you can use canine for guidance, then why not use canine guidance? It's easy to incorporate into your full mouth reconstruction dentistry or into your day-to-day dentistry. Even if you're conforming, you can use canine to steepen the guidance without reorganizing the treatment. As we discussed in previous video, that you can add composite incisal to the contact point in order to steepen canine guidance. So you just don't forget that technique is available, and make sure to distribute the guidance if canine is compromised, which is heavily restored or implant. So don't worry about using groove function. Groove function is very beneficial when you want to really distribute the load. However, it's a little bit tricky to incorporate into indirect restoration. Your mounting needs to be accurate, your technician needs to be on the ball, make sure that they understand what they're doing in order to use groove function, whereas canine guidance, as I said, for technically is easier to incorporate. So I hope you found this video useful. If you have, please share this with your colleagues and friends. If you have any questions, please contact me on social media or go to my website www.drdevangpatel.com, and I'll see you in the next video where we will discuss about some of the treatment modalities of teeth which are supra-erupted.